Okay, we are recording. Let me share my screen. I'm going to go back up to one screen, just letting you guys know this training is for educational purposes only. I'm not allowed to give any medical advice. It is not a substitute for medical advice, diagnosing, or treatment. It's for educational purposes only. If you have questions about the material that I'm providing tonight concerning your personal medical condition or treatment, you'll need to talk with your physician or your healthcare provider, whether it's an acupuncturist, chiropractor, so on and so forth. In accordance with my state licensure, I am not permitted to offer any medical advice outside of my doctor-patient relationships. So if you are not my patient, I'm not able to answer any questions. If you have questions about the general content that we're talking about tonight, I'm totally open to those. Just know that I won't be able to do that. Okay. All right, here we go. So I am Dr. Delores Stevens. I am a naturopathic medical doctor. I've also been in the medical field since '95. I was a registered respiratory therapist. Also became a certified cardiographic technician, was then a licensed massage therapist. Now I'm a licensed naturopathic medical doctor. Also went on because I've learned that there was so much grief that was impacting people's health that I went and received the training as a certified grief recovery specialist. I also do a lot of energy work. So I do shamanic work, I do Reiki, a lot of just energy healing, just to have my hands on the body, just to listen to the body's messages. I work within love and light, and I just want to be that conduit for God's work. But in my medical practice, I had extensive training in what we're talking about today, physical medicine. With my massage therapy background, I was really drawn to a lot of the physical medicine components of this. In naturopathic school, you're trained as a chiropractor as well, not to the degree that they are, but you are trained in the manipulation. And so with that, I did a lot of internship in physical medicine and had a lot of chronic pain patients. Also studied a lot of nutrition, biochemistry, botanical medicine, homeopathy, counseling, et cetera, everything that goes along in naturopathic medical school. I did extensive internships in gastroenterology, physical medicine, cardiopulmonary, ENT, nature cure, which is very, very natural medicine. My practice focus, I focus on chronic viral conditions. EBV is my primary condition that I see a lot. It ties in with GI issues. Chronic pain is always a concern. Grief recovery, spiritual healing. I deal with a lot of anxiety, grief, mental health, and that relationship with the physical, because the body, mind, spirit, it does equal whole healing. So, okay, sorry guys, I'm having to flip back between the waiting room too. So, okay, so let's talk about what we're going to talk about tonight. Learning objectives. We're going to learn some about the effect of pain. We're going to look at the pain pathways, the different types of pain, the role that inflammation plays in pain, and then let's look at the doTERRA products to support us. So what is pain? Well, we know pain is an unpleasant sensory and emotional experience. It's also associated with actual or even potential tissue damage, or described in terms of such damage. And this is by the International Association for Study of Pain. I've looked at so many studies in the past week for pain, and I've got them all referenced at the end, so feel free to tag into those if you need to. So the effects of pain, they're pretty significant, I will tell you. This is a major public health problem, with back pain being one of the primary things that we see a lot. Low back pain is really big. Rheumatic pain, so like arthritis, things of that nature. Neuropathic pain is big. Fibromyalgia. It has a really big economic and social burden too, because people that have been in even acute pain, and I'll get into what that means compared to chronic pain, which is longer term, it affects your daily activities, your quality of life, your family environment. Everything changes. And it affects the sensory and the emotional components too, because anxiety and depression are really big in chronic pain. And so what we see is that 60% of chronic pain patients, they go to the doctor like 2 to 9 times per month. That's a lot. Like I go to the doctor 2 to 9 times every decade. So 11% of those go at least 10 times a month. Now, these are chronic pain patients. This affects 100 million Americans. And it costs the United States, their health system, $300 billion annually. So you've got like 40 million doctor visits. And you can see why, because 11% are going to the doctor 10 times a month. 40% of work absences are due to chronic pain. So it does have a big effect, and you may wonder, why is that? Well, look at all of this. It isn't just pain affecting the body. So let's look up here at the very top, chronic pain. Let's go around like we're going, let's go clockwise. So socially, it's going to affect your work because your quality is less because you're in pain. Your family, if you ever felt irritable when you're in pain, absolutely. Your social network, it's not really at the top of your priority list when you're in so much pain. You're also not looking at the rest of your health. You're pretty focused on the one issue that's bothering you at the time. Your physical function, your daily life activities, your mental health, your social and family function, all of that is thrown out of the normal. And our sleep is interrupted. We're anxious, we're fearful, we have depression. Our coping skills kind of go out the window. Just think about it. If you just stub your toe, you can't even think straight for a little while. Somebody asks you what's wrong, you can't speak, you can't respond. It's difficult to even like tell someone what's happened because you're very disrupted. And so biologically, what's happening to your body, and this is nociceptive, and I'm going to explain that, but that's just a receptor. So, but this is our body's reaction to injury, trauma, infection, illness, cancer, nerve damage, all of those. So you can see it all works together. It's not just one component, because remember, body, mind, spirit equals whole wellness. And so we had to take that social component. We had to take the biological component. We had to take the psychological component. All of it is very compounded and affecting us as a whole. Now let's talk acute versus chronic. So acute means it just happened. It doesn't mean that it's adorable. It means that it just happened, or it's within the last 3 months. So acute equals short term. Excuse me. So the cause is generally known, because if I have pain that just came up today, I'm going to know it's because I was moving a lot of stuff over the weekend, or I was working in the garden, you know, a lot and my back is hurting, or I was in a car accident. You know, I know why. Where chronic pain, and you can see here on the right, it's often unknown. They're like, I don't know, just over the last 3-4 years, my back has got worse and worse and worse. The duration is short. Like I said, it's used typically less than 3 months. Chronic, anything more than 3 months, we're going to call that chronic. The treatment options are different. With acute, we're going to treat that cause. There's an underlying cause, whatever that was. If it was an injury, if it was an infection, whatever it is, we're going to treat that. The chronic pain, a lot of times we're unable to find what that underlying cause is, and that takes a lot more of investigative work. So these are some of the leading causes of pain. Low back pain, and you'll see it LBP, and that's pretty generalized for low back pain. Headaches are a big cause of chronic pain, because you know, if people having migraines that are not being resolved, that's a major issue. You can lose work. You can your quality of life is going to be affected with pretty persistent migraines. Fibromyalgia is a big one. Motor vehicle accidents. So this is shortened to MVA. Motor vehicle accident. So that's a car accident. Then a lot of times they have chronic issues that result from them, whether it's low back pain or neck pain. Also ergonomics. How are you sitting in your chair at work? How is your desk situated? Is your computer too high or too low? Are you doing repetitive motions? Are you unstable and more prone to falls? Is posture really an issue? Not as much as we think. The primary posture issue is that forward head posture. And we all have that to a degree, but with us more on computers, the forward head posture is about the only posture issue that has been found to cause long-term chronic pain. Weakness. So, you hear this thing about my core is weak, my core is weak. That typically, and there's studies that back it up, is not really a main cause of chronic pain, that your core is weak. So if you've been told that, just know that there may be some other underlying issue that is actually the cause. And so anxiety and depression, these actually can make pain worse. And there was a study in the Journal of Pain that showed that the psychological variables that were present before like a total knee replacement, they were highly related to the outcome. And so that means, like, if there was a lot of stress, anxiety before the surgery, then the recovery from the surgery took longer and it was more challenging and they had more complications. And so they found that the treatment of any comorbidities, whether it was anxiety, depression, or something else that was going on, needing stress management, those were actually more effective than surgery. So that helps to know that, like, sometimes if you can just treat an additional issue, you may have some pain relief. And I've seen that firsthand when we're talking about grief. So look at these two pictures. You have got a paper cut and a heart attack. And you would think the paper cut hurts a tiny bit because it's a tiny little cut, and the heart attack hurts really, really bad. Here's the interesting thing. The sensation of pain is not dependent on the tissue damage. Because have you ever had a paper cut and you just think you're dying? It hurts so bad. It's like one of the most intense pain at that moment. You can't ignore it, and it's not really silent. It's there. It's letting you know you sliced it. But heart attacks, they can actually have, you can have some tissue damage without that signaling happen from the heart to the brain, because we have silent heart attacks all the time. People come in, they think they're having indigestion. They don't feel any pain, and their heart muscle is actually dying, and they don't even feel it. MRI results. There's some studies that show that there was one study that I was reading, and it was talking about they were doing like hundreds and hundreds of MRIs on people's backs, and there was like tons of joint dysfunction, and the people had no pain. And so it doesn't mean that the function equals the result of the pain. So it could be that you could have herniated disc and not even know it, because that's the case. There's so many people that have that, they don't know it, they don't have the pain. So one of the effects of pain too, emotionally, we feel fear and defensiveness. And so I'm defensive when I stub my toe and somebody comes and they're trying to help me. If you ever felt that, leave me alone, don't touch me, you just have to cope with it. It makes you very defensive. Imagine if you were in chronic pain for years, how that fear and that defense would really come up, and you would be physically guarded. Is that a good thing? It could be. This pain is also a signaling system to warn us to take care of that area. And it also can create some immobility, so not willing to move. And that could be a good thing too, and we'll talk about that a little more. Let's look at the pain pathway. Don't let this scare you. And I chose a blurry one because I wanted it to blur out some of the words a little bit, because they don't really matter on the picture. And so what I want to do is you guys, if you've been on my trainings before, you know that I love to use pictures to walk you through a process. So nociceptors, and that we're gonna get really familiar with that term. So nociceptors is a naked nerve ending. So that means naked means it doesn't have a insulation. There are a lot of other nerve endings that are insulated with what we call a myelin sheath. They're insulated. These nociceptors, they are not. They are raw, naked nerve endings. They're in the skin, the muscle, the joint. bone, and they're in some major organs, but they're not in the brain. So that's really important because we're going to come back to that. We have different types of nociceptors, so think about different types of receptors for pain. So nociceptors are for pain. They can detect chemical, which could be like hot peppers, or breathing in, like, you know, some type of chemical that causes a reaction. Temperature, it could also, you know, so like hot or cold. Physical, so that would be like pressure, smashing your finger in the door or hammering it, you know, or dropping a jar on your feet. So those are the different types of nociceptors. So those are pain receptors that are all throughout our body except the brain. I'm going to come back to that. So there's different types. There's A fibers and there's C fibers. And so that's just a term we're going to talk about throughout this. You don't have to commit it to memory. And one more time, if you guys are on here since we started, if you'll mute yourself, it just cuts down on the background noise. We really appreciate it. So here's the pathway. Nociceptor, you see down here at the bottom, here's the little, so you can see naked nerve endings, they look like. And I bet he dropped a jar of something on his feet, on his foot. So bang, pain. So the signal is going to go up this either A fiber or C fiber, up through the spinal cord, into the brain, into the thalamus and the hypothalamus, and there's other areas too that it goes to. And then the pain sensation is felt, or it's not felt. And so you can see here, here's the area in the spine. It travels up the spine, it crosses over, and then it goes into the brain stem, and it's still traveling up through this spinal cord and into the cerebrum, into the brain material then. And then once it's in the brain, it goes into multiple places in the brain. And so that's just something to keep in mind as we move along. So nociceptor, boom, crash, or a chemical reaction, or hot, or damage, physical damage, physical injury. So hope that makes sense because we're going to move on. So look at the pain signaling. Let's look at this picture again. So I want you guys to look at the picture. It's very similar to what we did before, but I'm going to explain it a little bit more. So when the brain receives this trigger, pow, you've hit your hand with a hammer. It perceives this as a threat and it wants to know more. And so what happens, that the sensitivity in the tissue around the point of injury, you can see here's this nerve ending, this nociceptor, and it has really got fired up now. And so now it's going to become like really hypersensitive because it wants to trigger the rest of the area to be more sensitive because now it's on guard. And to do that, to create this hypersensitivity, it creates a release of these little vesicles filled with a neuropeptide called substance P. And substance pain, you can remember that pretty easy. That is released, and that allows that area to be really triggered, okay? So then those nerves that have become really sensitive, then they're stimulated more easily with movement, because now all of his little friends that are in this area with him, they're all on alert. They're very sensitive because they're making sure that there's no other injury going to happen. And so then those surrounding muscles, so then his hand is going to react. It's going to restrict the stimulation of those nerves because now our body has moved into protection mode. It doesn't want us to damage anything else. And so it moves into this place of guardedness. Movements are going to be guarded. And so this is one of the initial jobs of pain. Joyce, would you mind muting yourself there? Thank you. And so this keeps you from moving any tissue because your body wants to resolve the pain, and to do that, it wants you to be still in that area so those nerve endings can kind of calm down. So I hope that picture makes some sense as we move on to the next one. Different types of pain. There's 3 primary types of pain. So nociceptive pain, and we now know what nociceptors are. They're our pain sensors, right? So we've got these little nerve endings that are detecting pain. So that's our first type of pain, is something that has been detected by a nociceptor, by our pain sensors. There's also neuropathic pain, and we've heard a lot about that. I'm going to talk more about it, but this is a pathological issue. So that means it's not normal. And so nociceptive pain is very normal because it's very normal in daily activity for us to mash our finger or for us to get burned, you know, different things, or to eat something hot. We need those pain sensors to be on alert to tell us. And so neuropathic pain is not one of those. It is not a pathological, I'm sorry, it's not a normal pain issue that happens. It is pathological, and it is mediated by sodium channels, and we're not going to get into that, so don't worry. Then there's inflammatory pain. We're all familiar with inflammation a little bit, and we will get a little bit more, but inflammation in excess causes pain. There's a 4th type that we're not going to talk about. It's alloplastic pain. It's just for completion, it's a glial mediated immunoresponsive pain. But then there's also mixed. So you can have nociceptive pain and neuropathic pain, or you can have inflammatory pain and neuropathic pain, and that is a big combination that we do see. Okay, so this is just a little bit more of what we were talking about, okay? So I'm gonna hold you guys just a minute. People are in the waiting room. Okay, manage them all. Okay, here we go. So now these in the pink are primarily nociceptive pain. So these are, you know, pain related to damage of somatic, so of just our, you know, arms and legs and hands and feet, or visceral tissue due to trauma or inflammation. And then down at the bottom, you can see a list: osteoarthritis, rheumatoid arthritis, tendonitis, bursitis, list goes on and on. Then the blue is neuropathic pain. So this is something that is related to damage of either peripheral, so out here in the periphery nerves, or in the central nerves, so along the spinal cord. Predominantly neuropathic symptoms. So we're looking at the PHN. So this is postherpetic neuralgia. So this is someone that after they've had shingles, if it's not treated quickly enough, they can develop postherpetic neuralgia, which is like an ongoing pain syndrome related to the shingles virus. Also, there is painful diabetic peripheral neuropathy, and we see this a lot. There's also lumbar or cervical radiculopathy. All that means, all that means is that radiculopathy just means it's radiating out. It just means it's coming away from the lumbar spine, which is your low back. I'm sorry, lumbar, yeah, is your low back or your cervical. And so have you ever had pain in your neck and you're like, oh gosh, it's going down my arm? Or pain in your low back and you're like, it's going down my leg? That's all radiculopathy is. It means it's going down your arm or your leg. That's all that means. And then there is this over here in the green, sensory hypersensitivity. And this is something we see a lot, and it's common in society. It's pain. It doesn't really have an identifiable nerve or tissue damage, but it is very persistent, and it's thought to be from some dysregulation in those nerves that we were talking about. So those are things like fibromyalgia, irritable bowel syndrome, tension type headaches, interstitial cystitis, pelvic pain syndrome, chronic fatigue, restless leg, list goes on and on. So you can see that, you know, we talked about there's mixed. So here's the neuropathic, nociceptic, and this hypersensitivity. And in the middle, this is people with a lot of them. And this is what we see a lot of times with chronic low back pain. It's all 3 of these. It's not just one. And so when we talk about pain, you can see how complex it is. And at the same time, it's very simple, but it's very complex. So that in itself is complex. Okay, let's talk inflammation. And these are just some conditions that inflammation is associated with. And you can just take a quick peek at this to see if you see something that you can identify with, whether for yourself or someone you know, and that'll allow you to be really in tune with what we're going to talk about. So inflammation is awesome. We would not make it without it. It is a normal response that our body has, excuse me, to injury, to an insult, to an irritant. And so you can see here in this picture, it looks like a splinter has been impaled in this tissue. Harmful things enter the body, and our body's going to react to it. And so our body is going to have an inflammatory reaction, which is part of the healing process. And so whether, and this splinter may have had some bacteria on it, so it could bring some pathogens in with it. It's going to definitely have some tissue damage from that puncture. We could also have like chemical damage. So like from radiation, like when people have had radiation treatments, we definitely see an inflammation from that chemical damage. And you can see here, and we're going to talk a little bit more about this, these are the primary things that we see associated with inflammation: pain, swelling, wellness, warmth, and redness. You can see how the tissue is coming up into protection. It's swelling the tissue. It's bringing a lot more of those helper cells in to help make sure that none of that bacteria that came into that opening is going to cause an infection. It's trying to block off and wall off anything that it could bring in. But now there's diseases of inflammation, and so these are inflammation that has kind of got out of control, whether it is that we were exposed to a pathogen and our body reacted, and then it maybe have overreacted. So like cystitis, so that's infection of the bladder; bronchitis, inflammation of the bladder and inflammation of the lungs; otitis media, so this is middle ear; dermatitis of the skin; and then chronic diseases like rheumatoid arthritis or Crohn's or ulcerative colitis. So those are some ways that inflammation affects us, and these are the 5 cardinal signs of inflammation. And so, like I said a moment ago, those that pain, redness, heat, swelling, then loss of function is a big one, and that is what we see in chronic pain. More so is some of the swelling and loss of function. The pain, definitely. Heat and redness, over time it might go away some, but the swelling might stick around a little bit, but it might go down over time. It's however our body compensates. But that loss of function, that can be longer term. And so an example is like of your sinuses. So on the left side of the screen, you'll see a healthy sinus, all in green. This is your frontal sinus. This is your sphenoid sinus, your ethmoid sinus. All of these sinuses are, maxillary sinus, are air pockets. There's nothing supposed to be in them. But then if we have excess mucus from like a sinus infection or inflamed sinus lining, that is very painful. It's red, it's warm, it's painful. And so all of that pressure that's in those cavities that are normally empty is pushing out, and that's why your forehead hurts, why your cheeks hurt, why your teeth hurt. All that inflammation is pushing on those nerves and on that healthy tissue. So this kind of helps you just see like why sinus issues, whether it's a sinus infection or just some inflammation, can really be painful, because you see how it normally was, and then when it's got that inflammation, it causes a whole different picture. So inflammatory pain, there's 3 responses that our body has to inflammation, that if it continues. So let's say you had an injury or an infection or radiation, and it was longer term. And so it wasn't just an acute situation that your body was having the inflammation to. It could over time, and with chronic pain due to inflammation, we see what's called hyperalgesia. And so we know algesia usually just means pain, right? Hyper, too much. So it's an increased sensitivity to pain. So, and I'm going to give you an example that's my own. 8 years ago, I had a back injury that was really extensive, and I lost a lot of the function in my lower left leg. Well, so currently, the tissue, the skin on the back of my left calf, I can't really feel it. But what I can feel, what is hypersensitive, we have dogs. If the dogs brush the back of my calf, it literally feels like I have been zapped with electricity. That tissue is very hypersensitive due to that inflammatory injury that happened years ago. So that is an example of hyperalgesia. I can't really feel it, but it is hypersensitive to pain when it should not normally be. Allodynia, oh, I'm sorry, this is allodynia. I got it mixed up. Is pain from stimuli that don't normally cause pain. So that, okay, so I do have the hypersensitivity. It is hypersensitive, but it's also numb. So this is allodynia, so like pain from stimuli that don't normally cause pain, because if my pants brush the back of my leg, that causes pain. So hope I didn't confuse you too much. So it is kind of a combination of them both. But hyperalgesia, we see this a lot in like patients with fibromyalgia that are just really sensitive to pain. And it doesn't mean that they don't have a high threshold for pain. It means that their nerve endings have gotten a little too sensitive to pain. And that almost always happens with chronic pain, just so you know, is that the nerves are so stimulated, they get hypersensitive. There's also a complex regional pain syndrome. This is CRPS. It's also known as sympathetic maintained pain. This is severe neuropathic pain disorder. Can result from like a major or minor trauma. And we're not going to go into that too much. Just want to let you know, like, these are some of the 3 responses that happens with inflammatory pain. So acute. And so we talked about this. This is intense and it's a short period of time. An example, sprained my ankle, or was in a car accident and had an injury. These are mediated by, remember we said there's alpha fibers and C fibers. So this one's mediated by alpha fibers. Chronic, prolonged, mediated by C fibers. And this may seem like I don't need to know this, but when we get to the products, this is the only reason I'm telling you this. Certain products that we have work on certain fibers or certain mediators. There's also, and this is very sciencey, so don't let these words freak you out. These are mediators, so they're molecules that are at the site. So go back in your mind to that puncture wound, that splinter in the skin. So at the site are these mediators. There's 5-HT. This is, I'm not even going to go into all of these. TNF alpha, interleukin 1, 6, and 8, histamine, nerve growth factor, on and on and on and on. You can see all of these are things that are at the site to mediate the pain. And so they're there to kind of be like they're like the scouts. They're like, okay, guys, do we need to bring in a bigger army or have we got it? Okay. And so these are produced from like necrotic tissue, which means tissue that is dying. So think about a burn, somebody that's been burned pretty severely. There's tissue that has to die away to make room for the new tissue that's going to grow. And so at that site, there's going to be a lot of these mediators bringing in more soldiers to clean everything out, right? So the necrotic tissue area, there's going to be all these mediators. They're going to interact to really activate those nociceptors. So it's like in a burn patient. Have you ever heard about burn patients that said, I don't even feel it anymore. Well, those nociceptors were burned off. And so they're at different levels in the skin and in the organs. And remember, we talked about they're in some of the major organs. And so once they get into the area where the nociceptors have all been burned away, there's no pain there. And so that kind of helps you just to understand those nerve endings a little bit. So I hope that makes sense. And I know this seems a little super sciencey, like we're at convention and we're learning all these huge words and all this stuff that doesn't make sense, but just know that I put all this in here because then what I did is I looked up all of the products that I use for pain or inflammation, and I wanted to see which one of these the products addressed. And so I'm going to share that with you. Oops, I think I went one too many. No, okay. So this is the best picture right here of everything that we're doing, because this is definitely chemistry, but I don't want you to freak out, because what I want you to look at is, look right here. This pathway right here is what we're really talking about, because this is what causes pain, so basically, so we have pain down here that is caused by this process. We have fever that's caused by this same process, bone formation. So this right here, if you think about, let's just take ibuprofen or Tylenol. If you use one of those, so you've got traditional NSAIDs right here, it's going to block this. It's called COX-2. So an NSAID, so you're talking about like some non-steroidal anti-inflammatory drug. So let's talk just, anything that you can think of on that nature. It's going to inhibit this. So it's not going to cause pain. It's not going to cause fever. So when you have a fever, you're like, oh, I'm just going to take something to reduce my fever. And it's also going to help with my headache and my body aches, all that stuff. So that's why it does it. You're inhibiting this process right here. Okay. So here's all of these numbers I just rattled off earlier that were on this slide right here. See, there they are. Boom, boom, boom. IL-168. Look here, IL-168. They're right there. Okay. Also, PG right here. That's a prostaglandin. PG right there. Okay. And I'm telling you this because what we're going to look at is important here, because we want a typical inhibition of COX-2, because we want this pain signaling system to be dampened a little bit, because it's gotten out of hand. It's gone a little crazy and we need it to calm down. So this is a really good way to look at how can we reduce the pain. We can inhibit the COX-2 pathway. So this is what we're going to look at when we're looking at oils and oil products. We're going to look at what is going to inhibit these things. Okay, so we know that this is inflammatory stimuli, so it's going to ramp it up. So we want to find oils and herbs that are going to reduce or inhibit these interleukins. Okay, so that's what we're going to look for. So let's talk really quick about how does inflammation affect neuropathic pain. Well, if you think about a nerve, okay, and then you've got it squeezed by inflammation, because if anything is inflamed, it is going to be swelling, So, okay, so let's think about if you've ever sprained your ankle and it swells, that's a good part of your pain, is that swelling, because your ankle is supposed to be a certain size, and then once we have extra fluid in there and it's pushing out on the skin and it's pushing the nerves and all of that material in there, it's going to cause pain. So injury or disease of nerve tissue. Shingles is a good example of that. Trigeminal neuropathy, or trigeminal neuralgia, actually. I think I typed that in wrong. It's trigeminal neuralgia, and so that's of the face. Diabetic neuropathy, we're familiar with that. cervical or lumbar radiculopathy. Remember that word again. It just means pain going away from the spine. There's also the chemotherapy-induced peripheral neuropathy, and we talked about that some like with earlier. So neuropathic pain is typically really sharp. It's stabby, it's burning, it's prickly. It feels electrical. I've had patients say it felt like zinging, or, you know, I was being shocked. So those are kind of the way, you know, because typically nociceptive pain is like dull, achy, boring pain. But when you've got neuropathic pain and they're saying it's sharp, it's stabbing, it's burning. So this is for you, like when you've got pain and you're like, oh gosh, it feels like somebody's stabbing me. You can think, I wonder if that's neuropathic pain. Well, it could be. So, and if a nerve is inflamed, that's neuritis, you know, so we've all got these itises, you know, bursitis, inflammation of the bursa, on and on and on. So itis. The correlation though between inflammation and neuropathic pain, it's somewhat unknown. It's being studied, but there's not a ton of data for us to go on to like really know what is the cause and how to really intervene there. So you may be thinking, well, okay, I got LLV. Do I really need alpha CRS? Well, we're talking inflammation. I love alpha CRS for inflammation, and here's why on this picture on the right. So antioxidants is a big thing that we hear a lot about, and free radicals. You may be like, I'm not really sure what free radicals are. Just know that they are molecules in your body that they're kind of like a gang of teenagers that are on the loose. They have nothing to do and they're getting into all kinds of trouble. And so you need something to calm them down and to give them something to do. And so antioxidants kind of like match up those free radicals with each other so they stop being so overactive. So alpha CRS is a phenomenal herbal formula that helps to lessen this free radical excess. And so when there's free radicals, we hear about oxidative stress, but we may be like, I don't really know what it means. I just know that I hear about it. It's when these free radicals are kind of like out of control, and the damage that it can cause to our body, it can then lead to inflammation. It can also lead to tissue injury. So the more that we can keep the antioxidant and free radical seesaw balanced, the better we are. And so that's why alpha CRS is such a great component of this lifelong vitality system, because I've had so many people say within a week, my pain was starting to reduce. Well, that depends on your free radical level. So of course, if you have a lot of inflammation, if you have a lot of free radicals, you may not see that quick reaction. If it's less, then you may see a really quick reaction. So do I really need alpha CRS? Well, it really depends on if you want to have inflammation or not. And inflammation is not just about pain and joint and muscle pain. It also is contributing to lipids. So we're talking about like cholesterol. It's also about protein and nucleic acid. So we're talking about DNA. So do I really need alpha CRS? Absolutely. We all do, unless we live on a blueberry farm and we eat all of those and eat grape skins all day. Yeah, you probably do need some alpha CRS. So here's some oils that were studied in neuropathic pain. In Augusta, Georgia, they're actually recruiting right now for this study, and they're using a 10% dilution of turmeric, black pepper, geranium, ginger, peppermint, rosemary in jojoba oil. And so what they're looking at is they're looking to see if there's going to be a reduction in that pain transmission. So we looked at the pain transmission, how that all goes up through there. And then remember when we talked about those site mediators, so all of those little soldiers that are at the site of injury that are trying to like see if more pain needs to be created to make us protect that area. So what they're trying to do with this oil blend is to see if these oils will compete with those things that were at the site. So that 5-HT, the acetylcholine, the substance P. So they're trying to see if it's going to compete with it. Because, you know, just how our copaiba, our wonderful copaiba, it acts like CBD, and it's because it can be accepted by the same receptor. That's what they're looking at here. They're looking to see if these oils can kind of like trick the system by outcompeting those things that are at the site of injury that are trying to make us have more pain for longer. So the second study I looked at on neuropathic pain was a study of 46 patients, and this was like in an aromatherapy massage, and they were getting it 3 times a week for 4 weeks. They got lavender, geranium, rosemary, blue chamomile, which is amazing, and lemon eucalyptus. They found a 66% decrease in pain compared to 9% in a control group, and this was for chronic pain. So I thought this was great. I thought, wow, I'm going to put together some of these blends because they found so much. When I was reading like the details of like how the people were describing their reduction in pain, it made me think of like Symphony of the Cells and things of that nature, that you really see that over time that decrease in pain just continue to get better and better. So there's a couple of studies. So if you need to take a picture of this screen before I move on, feel free to do that. We're also going to post this on the page where you learned about it. So we will have this up later for you to see. So then there's oils and herbs that have also been studied in inflammatory pain. So frankincense and myrrh, both of those together are phenomenal. And there was a study that I found that where there was reduced swelling. And there were several studies actually that had these two components in here. And they found reduced swelling. And so this was of an extremity. So they found reduced swelling in the extremities and the reduction in the cytokines. So remember, those are the soldiers that are saying, we need more pain, we need more inflammation. So it helped to reduce those messengers. So the messengers were not they weren't so many, and at the same time, they weren't able to like recruit more to cause more pain and more chronic pain. Ginger also has been found to inhibit the COX-1 and 2. Remember, those two pathways, and the COX-2 leads to pain and fever. Remember when we talked about the NSAIDs? So ginger inhibits both of those pathways. And then turmeric, it modifies the interleukin production. So that is one of those messengers again. And so you can see a lot of this, it's like the oils, what the oils are doing and the herbs, they are telling these messengers that are currently telling our body to produce more inflammation, produce more pain, because it's trying to get our attention, trying to get us to protect it. And so the oils are calming that down. And they're telling all those little soldiers that are recruiting more people, that are like, soldiers, you guys can go take a nap. You know, we don't need you to be so super active. And so this is one reason that you may find, you know, that like over time, what we see is that, you know, patients that are in chronic pain in the beginning, and, you know, like as the oils are used consistently, like that massage study showed, 3 times a week for 4 weeks, over time, it's telling those messengers, slow down, we don't need you, go take a nap, you know, we don't need you involved as much. Green tea extract, and I'm bringing all this in because these are in all of our products we're talking about. Green tea extract, it outperformed diclofenac, and diclofenac is a non-steroidal anti-inflammatory drug, so it's an NSAID. And in this study that I found, it totally outperformed it. I can't remember the percentages, and I didn't put it in here. Pomegranate. You know, we've got this in some of our products. Reduces those messengers again. The IL-6, remember the IL-6 is the one that caused that COX pathway to happen. And we'll go back up there real quick because I want you to see again this. See this pathway? So we've got pomegranate that's inhibiting it, different things. So ginger, I think it was. Ginger inhibits COX-2. Pomegranate reduces IL-6, which causes that to happen. Pomegranate also reduces, and this is called HSCRP. And so this is like a lab test. Like if I want to know if a patient has inflammation and if I want to grade that inflammation so we have a starting point, I will test them for HSCRP. It's very sensitive. It's a high sensitivity C-reactive protein. And so it's an inflammatory marker. So if you're like, I need to go to my doctor and see how much inflammation I have, you can ask for this HSCRP test to be done because it's going to tell your doctor exactly how much inflammation you have throughout your system. It's going to give you a really good baseline of like where you are. And then beta caryophyllene, we're really familiar with this from our copaiba. There's studies, there were tremendous studies that showed, a lot of studies showing this anti-inflammatory and the antioxidant. And that beta caryophyllene is in copaiba. It's also in melissa, black pepper, ylang ylang, yarrow, myrrh. So we've got it in so many of our amazing oils. And so that's why you see a lot, you know, I've heard a lot, if you don't have copaiba, use black pepper. Here's why, is that same constituent. So there's also oils that are anti-nociceptives. So remember, nociceptive is that naked nerve ending that stimulates the pain. That's our pain sensors. So there's actually oils that are anti-nociceptive. So this is like, okay, so I would be like, this is my anti-pain oils. So linalool, we heard all about linalool for so many years. There's so many studies that show the linalool effect on the nociceptors. So lavender, coriander, cilantro, basil, petitgrain. You know, in my practice, like you know, for years, like I've been a massage therapist, so it's hard for me not to have my hands on and do some body work on people. I love to put lavender on them, and they thought I was just like calming them down, but I could absolutely see a difference in lavender on painful, tense muscles, and it just helped relax it so much. Monoterpenes as well is a anti-nociceptor. Celery seed, green mandarin, bergamot, wild orange, tangerine, grapefruit, lemon, lime, pink pepper, blue tansy, and Douglas fir. And then we've got all these carbones. So we've got dill and spearmint, and then carbacrol, oregano, eugenol is in clove, menthol is in peppermint, citronellol is in lemon eucalyptus. So when I was doing this, I thought, you know what? You could just go to your oil box, because we've all got all of these probably. And I would be like, allow my body to tell me what I need, because even if it's just basil, or even if it's just grapefruit, it's still going to help my pain. So when people say, what do I need for pain? Use anything you have. Just use it and use it and use it, because you can see one time wasn't enough. It was 3 times a week for 4 weeks. So what can help? We know lifelong vitality. It's got those essential nutrients that helps our system do all of those processes that helps keep that inflammatory process as low as possible. We've got the metabolism benefits, because it's going to help our body with all those metabolic processes. Again, alpha CRS with those powerful antioxidants, as well as in the omega. You cannot not have this in your regimen if there's any kind of pain or inflammation. This is a have to have, as well as the deep blue systems. Okay, so we've got the oils, and in those, so remember we went back, we had all of those studies that showed us the oils that were targeting the either anti-nociceptive, so that means no pain, or reduces pain, it reduces that signaling, or it helps cut down on all those messengers. So wintergreen, we also know wintergreen has like cortisone-like effect. And so we all know someone that's had to go in for a cortisone injection. You know, they're like, my knee is bad. They're going to do some injections on me. I'm getting cortisone injections. Sometimes they work, sometimes they don't. But wintergreen has cortisone-like effects. And so that's why Deep Blue is a great choice to apply topically for things like that. And then in Deep Blue Rub, it's got a little bit different where we actually have the addition of gardenia and osmanthus and aloe and chlorella, and those are amazing for the skin. And so it really just kind of helps the those raw nerve endings that are right at the skin surface. So, and then the polyphenol. This is something, this is super, super important. If you hear nothing else tonight, hear this. Frankincense, oil is not anti-inflammatory. The oil. Deep Blue polyphenol has frankincense herb in it. It is anti-inflammatory. Here's why. Frankincense constituents, the part that makes the herb anti-inflammatory, that molecule is too large to get through the distillation process. So the actual whole herb is in the Deep Blue polyphenol. So that's why if I have chronic pain, I'm going to be taking Deep Blue polyphenol because I need that anti-inflammatory component from the frankincense herb. I've also heard people say, well, frankincense oil helps my pain. Absolutely. There's a lot of reasons that it does that. But it is not because it is anti-inflammatory in its constituent property, okay? So that's really important, is that you know that the Deep Blue polyphenol is a very important part of the Deep Blue system. It also has the ginger, the curcumin, and the resveratrol. Resveratrol is a really, really amazing antioxidant. And so if you remember, the ginger and the curcumin, when we looked at the studies that was found for those, they were very powerful in reducing the signaling and the recruitment for pain. And so it allows us to have a reduction in the sensitivity, the chronicity. So it's not just continually recruiting more molecules to continue that pain. So Deep Blue, you need it all. Of course, turmeric, we're still awaiting those dual chambers. I meant to call today to see when it was coming back up. If anybody knows when it's coming, throw that up in the chat, because I've got so many patients waiting on this dual chamber to come back on the market because you just cannot beat it. I've got people putting turmeric powder in capsules and adding their oil to it. And I'm like, it's better than nothing. Give it a shot. So because turmeric is, we know it, you know, in Ayurvedic medicine, this is a very, very powerful anti-inflammatory herb. So the oil is what is sought in the turmeric powder many times. And so to have both of them, we're very, very blessed. Copaiba. So this is, of course, our CBD replacement because it's acting on that same receptor. It's given us the pain reduction and as well as over long term, reducing the anxiety. So whether you're taking it by the oil under the tongue or the soft gel, either one, it's great to have this. And I know last time Seth was like, how much would you do of each? Well, what I'm going to tell you is everybody needs a full dose of the Lifelong Vitality. Everybody needs to look at what is my concerns and what of these recommendations do I need to apply to myself. So, you know, the directions are on the bottle. Take it to your healthcare provider if you need like very specific and making sure that nothing interacts with your current supplements or medication, because there is nothing that I like better than the patient bringing the doctor everything that they're on. This is one of my favorite products right here. If you do not have DDR Prime in your inventory, that needs to be the next thing on your list. You need to make sure that DDR Prime is in your inventory. And here's why. It has frankincense, it has wild orange, litsea, thyme, cloves, summer savory, noli, lemongrass. It's like this is my favorite product, I think. I hope that you guys understand. So inflammation, chronic pain, there is no way that our cells are not damaged by chronic pain, stress, inflammation, nerve damage, anything that's causing us pain. We have some cells that are damaged. We have some DNA that is damaged. DDR prime, damaged DNA repair. This is what we need to use, what I need to use for DNA repair. This oil has been a lifesaver for myself, for a lot of my patients when we're looking at either chronic illness, you know, chronic pain. There's so many issues that DDR prime is amazing for. And so if you don't have DDR prime, please get this in your daily regimen, because DDR prime is probably one of the best things that doTERRA has come up with outside of adaptive and copaiba, and yeah, we could just keep going on and on, couldn't we? Okay, let's see what else we got. I can't remember. I got so excited. These are the last two options I want to talk about. You know, we've talked about how lavender with that linalool is very anti-nociceptive, as is ylang ylang and clary sages too. I forgot that one. Marjoram leaf is in here. For you guys that don't realize, marjoram is like a natural muscle relaxer. So I love to use marjoram for headaches. It gives that muscle relaxant feel to it. You know, add a little frankincense just to enhance it, and it's a great thing for like muscle tension. Then past tense, of course. And you may wonder, well, why does past tense work? Well, look, wintergreen, cortisone-like effect. You've got lavender, that's linalool. You've got peppermint, frankincense, cilantro, marjoram again, relaxing. Roman chamomile, anti-inflammatory. Basil, when we looked at that again, you know, we've got all of these. We know that all these constituents in these essential oils are reducing either the signaling or they're reducing the recruitment for more pain to happen, okay? So peace is a wonderful option to look at for pain that you might not have thought of before. You might just think, well, okay, it's for emotions. Definitely is, but at the same time, peace has so many amazing pain oils in it that it is my #1 go-to if I've got neck tension. And with patients, I have to always be conscious of how strong I smell, and past tense is stronger than peace. And so if I'm going to be in and around patients or in and around staff members that I need to be more conscious of odors, I'm going to go with peace over past tense. Sometimes it depends. I might have both. So, so always consider those and make sure that you have those as some of your options. Oil applications that we want to look at. Okay, we're all familiar with Aroma Touch. It is an amazing technique. Those 8 oils in that sequence provides such good results. I love how it works to reduce the inflammation. It boosts the immunity. It helps with the stress. It really helps return us to that homeostasis. Remember, homeostasis is just that balance that our body strives for. Symphony of the Cells. These are the top protocols that I would look at if you've got issues with pain. Excuse me. Okay, so if we're talking order of importance for infections, then infectious disease is #1, and then C2 is #2. But when we're talking about, sorry, I'm going to drink more water. if we're talking about pain, then we want to look at the underlying cause of the pain. And that's what you would address with the Symphony of the Cells. So I know that a lot of times the chronic pain that I see in the clinic, it might be from an infectious disease. It might be from a chronic infection. It might be from some cellular damage, or it might just strictly be from inflammatory. I asked Troy why he named this one Maxim. He said, because I couldn't call it anti-cancer. So we could also look at the neurological one. So if we're looking at, you know, like when I had patients that if they've got any kind of like, remember the descriptors for neuropathic pain? It's like stabbing, burning, prickling, electrical. Then I'm going to use the neurological one. The osteo one, so that's more for like joints. Sensory, even though sensory is typically more for, you would think of it more for like somebody on the autistic spectrum or ADD, ADHD, or all of those sensory type concerns. Think about that hypersensitive that we talked about in the beginning, that hypersensitive component of pain, okay? So sensory is a great one too when we've got someone that's in chronic pain and anxiety is just through the roof. They just are barely coping. Sensory would be a great one for that. I love Symphony of the Cells. It's something that I use a lot in my practice and in my home, and recommend it a lot. So if you don't have the Symphony of the Cells book, get it. And this is not the newest one. This is the version I have. So I know that there's some newer versions than this. So let me check the chat. I see people are chatting. I think they're talking to each other. Awesome, good. Okay, Sharon's got that. So I want to talk really quick about grief and pain, because grief is something that I work with a great deal. Grief can affect your body. It's not just an emotional state. So think about somebody that has chronic pain. You know, there's loss associated with chronic pain. So let's say I've had chronic pain and I'm on disability now because of my chronic pain. One, I lost my livelihood as being in the workforce. I might have lost my identity, depending on how the loss has affected me. Losses also could be contributing to chronic pain. So someone that's had a lot of losses, such as deaths, divorce, changes, a lot of changes in life, children moving away, financial, you know, situations, a lot of those losses can actually contribute to chronic pain. And so looking at this picture, you can see there's ways that grief can actually affect your body. It can cause headaches. You can actually have shortness of breath, and that's when you want to call the doctor. If you ever have chest pain, you want to call 911, of course. It can cause stomach pain and a lot of discomfort. Fatigue, of course, appetite loss, and nausea, dry mouth. So, you know, grief recovery, which I do, I have seen in my private practice, I have seen a reduction in chronic pain once someone has gone through the grief recovery program with me. So if this is something that interests you, jot down my email and send me a message if this is something that interests you. But just know, like, as we're dealing with people and, you know, as we're helping people understand about how to use essential oils, and if you know that there's a lot of losses in people's lives, then my dog is like burying her way through. I've got the gate up, and she's like, no, I'm ready to get through there. So if you, there it goes. I was saying that because I knew y'all were going to hear that gate fall any minute. So if you are working with someone, let's say that, you know, has a lot of grief events in their life, this is something that you might want to make sure you consider. So let's see, is everybody still awake? I hope you all have enjoyed this. I appreciate you all being here. I'm going to stop my share, see if there's any questions that we have. Okay. You may want to, okay, Sharon's talking to people? Okay. Thank you all. Any questions? If you guys have a question really quick, you can unmute yourself. I know we went over, and I apologize for that. I know that some of the issues in the beginning kept us from being able to jump on time. So, okay. Any questions? I'll give you just a couple more minutes if you have questions. If you don't.
I have a question.
Yeah.
On the DDR, will it help with anti-aging since it's a DNA repair?
I would think so. I mean, I would think that, well, and we know that frankincense is definitely a anti-aging, has constituents in there for that. So I wouldn't see why not. You know what I'm saying? Just because of the different oils that are in there that play a role in some of the anti-aging processes or the aging processes, especially like frankincense and such. So, you know, and I think because sometimes, I mean, we're going to age beautifully anyway, all of us, just because we're using our oils. But with the aging process, you know, we have so much that happens to just our cellular processes because of some damaged DNA. So DDR prime would definitely help those processes stay functioning more optimally so that we are able to benefit from that. You know, as far as like, is it going to keep you looking 18 forever? No, but nothing is. So just keep using your oils for sure. And if I think we all are going to benefit from DDR prime, to be honest with you. It's an oil that I've used for many years now, and I recommend it a lot. So I hope that answers your question. Anybody else? We'll give it a minute. Okay, awesome. All right, thank you, everybody. Any more questions? Do you know if extra vitamin C helps with inflammation? Well, you would look at vitamin C, what it is, as far as like inflammation. I'm sorry, somebody just wanted to come into the waiting room. You know, vitamin C is all about, not all about, but a big component in the detoxification process. You know, so when you're looking at vitamin C, you know, you want to make sure that all of your vitamins and minerals are optimally provided, especially like in your LLV, so that you do have all of those components of all those processes, like the detoxification process. Because if detoxification doesn't happen, then we're going to have an extra dose of inflammation. So I'm seeing a lot of questions about fibromyalgia. You know, it is just, it's such a hard one, you know, and I've really enjoyed the some of the Symphony of the Cells protocols for that. And when people ask me like which particular protocol, I usually ask what symptoms are really the most prominent right now. You know, because just like as we're sampling people, you know, for oils and stuff, and they may come to you and say, I have fibromyalgia. What oils are good for that? I'm like, what's your worst symptom? You know, because I can't give you I can't give you one oil that's going to help you with fibromyalgia, but tell me your worst symptom. And they're like, my shoulder's killing me, or my fatigue, or whatever. And then, you know, you narrow it down. And so, and I say that because the same thing, you know, applies when you're looking at Symphony of the Cells. You may think, well, which protocol would you use? Well, if you have the book, you can look and see that all of the conditions that it is really good for is at the top of the page. And so what I do sometimes, I may get somebody in and they have something that's so complex, I'm like, I don't even know where to start here. I'll just go flipping through the book, and I'll just look at the, the conditions at the top of the protocols, and see what is what's recommended for it. And I see Dr. Watson is on the call, and she's chiming in with some chat with helping with. So,
Dolores,
yeah.
You also have Grant Anderson up. If you'll scroll up a little, has a question.
Okay. Read that vitamin C and quercetin combined are much more effective and even synergistic, especially effective for allergic reactions. Oh, I mean, those.
Above was the one above. I thought.
Okay, one above. Let me go on up. Could you please repeat which oils are most effective for pain caused grief and loss? Well, here's what I will tell you for grief, and Sharon, you can chime in on this too as far as the grief. I definitely love to use the oils that are going to help the grief not become stuck in the lungs, because in Chinese medicine, all of the emotions have associated organs, and so grief can become stuck in the lungs. And so, of course, I love things that are going to allow the lungs to open up, such as breathe, or eucalyptus, or even buoyant heart, peppermint, different things like that. So what I would say is definitely look at your emotions book and get a feel for like what is the most pressing emotion involved, if that makes sense. Sharon, do you have anything to add on that one?
No, I think that's good. Good suggestion.
Because I don't think I covered necessarily oils studied for that. And I will tell you, in Troy's, Boyd Truman's book, there's a protocol called Emobic. And it's great. Oh, thank you, Alicia. Alicia says Hilly Chrism. She is an emotions oil genius as well. So Hilly Chrism, great for that, says Alicia. The Emobic protocol it's a combination of emotions and limbic. And so it's very soothing for people who are in severe grief moments. I would caution on those protocols. The forgiveness protocol, be very careful using that one. You want the person to be prepared for it. So having used the protocols a lot, that I'll just say that it needs some preparation for that one if you're looking at grief. And and there's so much that pain is associated with the grief. So okay, and I digress. Any more questions or anything before we jump off? Sharon, anything else in the chat I need to address?
Nope, looks good.
All right.
Great call.
Thank you, everyone, so much. And I'll see you guys next month. I can't remember the topic yet. So we're doing the last Wednesday of every month. And so, again, I'll post them on the pages, and we'll get the first 100 in. Thank you guys so much. I appreciate it.